Alright guys, today we'll be talking about the intra-aortic balloon pump. We'll be doing some explaining just kind of what it is, how it works, who it's used for. We'll do a quick review of some waveforms and some pressures, and then we'll do some nursing considerations. Okay, so to get started here, we'll just simply start with what is a intra-aortic balloon pump. So a balloon pump is a type of circulatory mechanical support device. So an intra-aortic balloon pump is going to have two main benefits. Both of them are going to be used to improve cardiac output. The first one here is going to be, it's going to decrease afterload of the left ventricle. So this is going to help with better blood ejection, more volume being ejected. And the second one is it is going to improve coronary artery perfusion. And we'll talk in just a second kind of how this works, but just know that both of these here help to improve cardiac output. And just quick side note, remember that cardiac output is equal to heart rate times stroke volume. Okay, so now we'll kind of move down here. So how does it work? Okay, so a balloon pump works by a method called counter pulsation. And what this means, or what this indicates, is that so the balloon is going to inflate during diastole, so when the heart is at rest and filling, the ventricles are filling, and it's going to deflate during systole. So both of these here correlate with these two up here. So we'll starting with the inflating during diastole. So this is how it's going to improve your coronary artery perfusion. So if you know, so we'll talk about location here in a second, but let's say here you just have your aorta here. So let's say this is your aorta and this is your little balloon pump here. So how this works is during diastole, so the heart's at rest, this balloon is going to inflate, so further inflate out here. And what that's going to do, it's actually going to kind of push this blood back up a little this way, and your aorta has your coronary arteries are coming off of your aorta there, your aortic branch. So that is going to improve the coronary artery perfusion almost by kind of like backfilling them to help improve your perfusion there. And then for the deflation during systole, so this is going to create a vacuum effect that's going to help reduce afterload, which is how you'll get an improved ejection fraction, more blood being ejected out of the ventricle. Remember that afterload, this is the force that the ventricle must overcome to contract. Force ventricle must overcome to eject blood. Not the best drawing here. We'll erase this. Hopefully that gives you a little bit of understanding of how it works. But yeah, so this is very important knowing or to understanding is that it inflates during diastole and it's going to deflate during systole. That's kind of how you get pretty much all the benefits of the balloon there. Okay, we'll move down here now. We'll go to, so who is it used for? Put this here. Oops, excuse me. Okay. So the balloon pump is primarily going to be used for patients with heart failure, specifically systolic heart failure. So you'll see heart failure with reduced EF. Remember, EF is ejection fraction. That's how much blood is being ejected out of the ventricle with every contraction. So you'll see some of these patients could have severely reduced EF, something around maybe 15, 20%. Normal is around 55% for an ejection fraction. So you'll get patients that basically just need help with the forward movement, the forward flow of blood. Another one, which is kind of plays hand in hand with reduced EF, is cardiogenic shock. It's very common. For patients who require a balloon or need a balloon, just some assistance there. You could see it for patients who have STEMI, MI. You could also see it for patients that maybe post-cardiac arrest. Sometimes a balloon kind of allow the heart to rest. It decreases the workload, and it can help prevent some of those lethal arrhythmias like your pulseless VTAC or VFib. Post-cardiac arrest. And another common way is just patients will have it as a bridge to maybe heart transplant or an LVAD. Bridge to transplant / LVAD. Okay, so the big part of understanding a balloon is the waveform / pressures. Okay, so when you have a patient with a intra-aortic balloon pump, you'll have to do these things. They're 1 to 2 strips. You'll be checking for timing of the balloon. I'll make a separate video on kind of explaining waveforms in much more detail, because it's probably a little too much just for this one video here. But we'll just do the very basic here. So this is going to typically your balloon will be in a 1-to-1 mode, but to assess timing and stuff, the balloon has to be in a 1-to-2. In my facility, we rarely do 1-to-3, but some people might. It's just kind of a weaning. Basically, 1-to-2 it's every other beat, right? So it's not as much support as 1-to-1. Then 1-to-3 is even less support, and 1-to-2. So you can wean off and test if someone's ready for the balloon to be removed by doing stuff like that. But here we'll draw a simple or a basic waveform, your typical 1-to-2 waveform here. So it's going to look something like this here, and then it'll come up here, your dichrotic notch there, and then back here. Okay, so now this is what a 1-to-2 waveform will look like. So in this picture here, we have several pressures. We'll walk through all of them there. So the first one of the most important ones here, this here is going to be your augmentation pressure. So that is the pressure within the balloon when the balloon is inflated, right? So this should be the highest value, the highest pressure on your waveform. So when you see this, your augmentation pressure, that's the pressure of the balloon inflated, right? So once the balloon has inflated, you know that so the balloon's inflated here. So here, this is going to be your assisted diastolic value here. Assisted diastolic, and which means this would be your assisted systolic pressure. And how do I remember that which one's assisted and which one's not? I know that, so we know here the augmentation is when the balloon's inflated, right? So the purpose of the balloon is to basically assist the heart, right? So after it's inflated, which is here, then we know that the next two are going to be assisted, because that's the whole purpose of the balloon. So we move back before the balloon augmentates. So this here would be your unassisted beat, right? So this is going to be your unassisted diastolic, and this would be your unassisted systolic pressure. And again, how I remember that is everything for me is based off where is the augmentation, right? If it once it augmentates, I know the next one is going to be assisted. So prior to that, that is the unassisted beat. Now, when we're looking for things such as timing here, so remember this is your dichrotic notch right here, right? Dichrotic notch here and here, and we want these to be as close to as in line as possible with the unassisted and the assisted beat, because we know, so here's also your dichrotic notch. What does the dichrotic notch represent, right? It's the closure of the aortic valve, which marks the end of systole, so the beginning of diastole. So this marks the end of systole / the beginning of diastole. And remember, when does our balloon inflate, right? The balloon is going to inflate during diastole. So right here at the dichrotic notch, you'll see this upstroke. That's your balloon inflating. So that means, so you know it's timed correctly if both these dichrotic notches are relatively close to being in line with each other. So that's how you check the timing, and you want to make sure that those should be just about equal. So that's how you get your upstroke here, because the balloon's inflating, and then here the balloon deflates, and then it continues to even sharper deflate after systole has completed, or systole is initiated. Other things we're going to look at here, so it's important, some people get kind of tricked up on this, is your assisted pressures should always be lower than your unassisted pressures. Should be lower than unassisted pressures. And for me, it kind of makes sense because, like we talked about up here, one of the main benefits of the balloon is it's going to decrease afterload, right? So it's assisting the heart. So how are you going to make it easier for the heart to contract and work? It needs to decrease these pressures that it most overcome. So you don't want the unassisted values, or you don't want the assisted values to be higher, because then that's making the workload of the heart, it's increasing the workload even further, right? So just kind of take your time and think through it. It should be able to kind of make sense there, but your assisted pressure should always be lower than your unassisted. So if we look here, we'll start. So this is our assisted diastolic. It's about here, right? And our unassisted diastolic is right there. So definitely lower there. And then here is your assisted systolic, and here is your unassisted systolic. So you can see here that right about, so assisted systolic should be less than unassisted systolic, and assisted diastolic should be less than unassisted diastolic. So hopefully that makes sense there. Let's see if you have room down here. Okay, next thing we'll talk about here is just some nursing considerations. And also kind of things to monitor for. So one of the most important ones is going to be the location of the balloon. So every morning you should get an x-ray every morning just to verify the location, proper location of the balloon. we'll draw this out in a second here, but it's going to be about 1 to 3 centimeters below the left subclavian artery. And this balloon is it's resting in the descending aorta, right? Intra-aortic balloon pump. And it should be 1 to 3 centimeters above the renal artery. We'll talk about why that's important here in just a second. And also, typically it's in between the second and third intercostal space. Second and third intercostal space there. So you'll be able to see this via x-ray. Obviously, your doctors, your providers will be looking at it to confirm everything. And, nurses, at least we do not reposition the balloon, right? So if you do notice that, maybe your augmentation's low, the balloon's not working correctly, or we'll talk about urine output and pulses and stuff like that, other ways to maybe give you an idea the balloon could be positioned incorrectly. You're going to want to let the provider know, and they'll be the ones to come adjust it. Another obviously very important thing is you're going to be wanting checking pulses at least every hour, right? And especially distal pulses. So, typically the balloon, we see it more commonly in the femoral arteries, inserted through the femoral arteries. You could see it axillary, especially if someone's going to have it for a long time, because when it's inserted femorally, they are bed rest. But that's typically where we see it. Axillary gives a lot of problems with the balloon kinking and not augmentating properly and stuff. So typically we see it in the femoral artery. So definitely you're going to be wanting checking your pulses on your feet. And it's also very important to check the left radial pulse. Why is that? Because if your balloon is too high, it can occlude this left subclavian artery, and that will occlude this left radial pulse, so you won't be getting adequate perfusion. So it's always important to be checking for the pulse, checking capillary refill, other things, other indications of perfusion. So if we draw, see if I can do this any better. Like I said, here's your aorta. Here's your balloon in there. So it's going to be, let's say this is your subclavian artery. So if the balloon's too high, right, if the balloon was here, it'd be blocking that flow of blood, so that inadequate perfusion. So you want it below the subclavian artery and above the renal artery. So let's say the renal arteries are here. And that's why you want above the renal arteries, because another thing you're going to be checking is urine output. If you have diminished urine output, that could be an indicator that the balloon is too low and it is maybe occluding these renal arteries. So if the balloon was maybe here, that could be occluding the blood flow there, the perfusion to the kidneys, so you'll get diminished urine output. So it's very important to be on top of that. You'll be checking that every hour as well. Another thing that's very important to continue checking is going to be the site for bleeding or any signs of hematomas. Once again, if you notice anything like this, you're going to want to alert your provider. You're probably going to have to hold manual pressure depending on the degree to if there's a bleed or a hematoma or anything like that. Other things to know, typically if it is a inserted femorally, the patient will be on bed rest throughout, and head of bed is going to have to stay at or below 30 degrees. That's just because of patients sitting up and bending, if they're at 90 degrees, between their torso and their leg there, that can clamp and cause issues or even rupture the balloon, which would be definitely a medical emergency there. So you're always going to want to make sure they're always bed rest and keep the head of bed at 30 degrees or less. Then obviously we're going to be monitoring just hemodynamics. you know, how's their blood pressure responding? You know, are they on pressors, especially if it's a new balloon? You know, is this increasing, you know, signs of perfusion, heart rate's better, blood pressure's improved, things of that nature. And then definitely won't cover it in a lot of detail. We'll cover a more detailed video with like kind of waveform pressure explanations and even the balloon console. But your alarms are going to be very important here, your pressure alarm. So you're going to always want to make sure you have a augmentation low limit. Normally we set this around 80 or 90, just say 85 here. This will just alert you if the balloon isn't augmenting. Say the balloon's augmenting in, you know, 75 or so, then it's not helping. It's not working properly. It's not helping to improve that coronary artery perfusion, and then it's not helping to decrease that afterload. So you're not improving the cardiac output, and you're not decreasing the workload of the heart. So you always want to make sure your augmentation alarm is set. You're going to want to make sure it's, you know, if your order is augmentation 100%, you're going to want to make sure you check that. If you have to print strips and document it, which I'm assuming you do, you know, make sure your printer's on, and you're going to want to make sure your standby alarms are always on there as well. I want to talk about one more thing real quick. I forgot to mention with this timing here. So we talked about how, you know, lining up your dichrotic notches there. So I'll cover these more in a later video, but the two most dangerous timing errors are going to be late deflate and / early inflate. And if we take a second here to think about this, it'll make sense, right? So, you know, we know the balloon is supposed to deflate at the beginning of systole, you know, right before systole, right? So if it's deflating late, that means the balloon is still inflated as the ventricle is contracting, so it's going to be occluding basically the forward flow of blood, right? Same thing with early inflate. So when is the balloon supposed to inflate? It's supposed to inflate at the beginning of diastole. So if it's inflating early, that means it's inflating during systole, and the same thing. It's just occluding forward flow of blood, which obviously is not going to help reduce afterload or reduce the workload of the heart. It's going to decrease and make your cardiac output worse. Occluding forward flow of blood. Okay, so that's just kind of a quick review there of the balloon, some basic stuff if this is your first time or haven't seen it much. So yeah, most important things I would say, knowing the two main benefits of decreasing afterload and improving coronary artery perfusion. Both these are going to help to improve your cardiac output. Remember that it works by counterpulsation, which means, you know, inflating during diastole, deflating during systole, or technically right before systole. People who it's used for, you'll see this. So if you're in a cardiac ICU, you'll probably see this quite often. Cardiogenic shock, reduced EF, STEMI patients, basically anyone that may need, you know, kind of to take the workload off the heart and give it a little break, right? Needs some support. Like I said, I'll make another video later explaining in more detail waveforms and pressures. So, you know, we talked about our augmentation pressures, you know, the pressure of the balloon. When the balloon's inflated, that should always be your highest pressure. And then we have your assisted diastolic and systolic. Remember, these come right after the balloon augments. So remember, the balloon is assisting the heart. So that's how I kind of remember that. And then you have your unassisted systolic and diastolic. So that's how you're going to check and see basically if the balloon is functioning properly, if it's timing, if the assisted values are lower. Those are all good indications. So this waveform we talked about was a 1 to 2 waveform. Like I said, I'll make another video later kind of going into more detail about some of these pressures and stuff. And then nursing communications, like I said, location's big. So 1 to 3 centimeters below the left subclavian artery, and that's important because you don't want it to be blocking the perfusion to your left arm. So you're checking that left radial pulse and all signs of perfusion. And then 1 to 3 centimeters above the renal arteries, that's important, so it's not occluding perfusion to the kidneys. So then you're going to want to check, make sure you're monitoring urine output And also another thing, a little quicker way to check is if it's between the second and third intercostal space. So we're monitoring pulses, Q1, especially distal, on the feet, that left radial pulse we just talked about, urine output, your site, looking for bleeding, hematomas, anything like that. And then make sure, the patient will be on bed rest. If it is a femoral balloon, with the head of bed, 30 degrees or less. Obviously, we're always monitoring hemodynamics, heart rate, rhythm, blood pressure with our ICU patients, but especially if it's a fresh balloon, we're going to want to keep a strict eye on that, and then making sure you set your alarms, making sure your alarms are turned on, and it's, the balloon is alerting you if anything is not working properly. So hopefully that gives you all just a little bit better understanding. Let me know if you have any questions in the comments. Like I said, I'll try to make a different video here shortly that will kind of go into more detail with these waveforms and some of these pressures, okay? Thank y'all for watching. Appreciate if you subscribe. Thank you.